So the first test for cervical instability is called the sharp purser test. So what we first have them do is have the patient go into slight cervical flexion. So we stabilize at C2 with the lumbrical grip. We have the direction and line of force. And then press the forehead into my hand as you're stabilizing C2. Monitoring for any patient symptoms. So the second test for ligament stability is called the longitudinal. So what we're first going to do is apply general traction, monitoring for symptoms. Let's produce any symptoms. No. So after that is done, we come back with a lumbrical grip again on C2, stabilizing C2, and adding traction. Again, looking for patient symptoms and facial expressions. So the third test we're doing is called the alar ligament test. So again, we're stabilizing C2 with the pinch grip. We first do a quick side bend in a neutral position and rotation. Then bring her up to a slightly flexed position, keeping the stabilization. Side bending again, slight rotation, and then again in a slight extension position. And then minimal movement should be found with this. So the fourth test for the ligament instability testing is called the transverse shear test. So we're going to do with the one hand is palpate for C1 and C2 and making sure that we're on the laminas and producing a shear movement. And with this test, no movement should be occurring. Again, monitoring for patient symptoms and facial expressions. So the last test is called the anterior shear test. So we're going to do is climb up and slide for the occiput, making sure you're between C1 and C2, and doing a directly upward movement, making sure the patient's head doesn't go into any extension or flexion.